let's start with the today's questions. So the first question is, the nurse managing a client's post-supratentorial craniotomy care should assure that the client is maintained in which position? So in this particular question, there is a nurse who is managing a client's post-supratentorial craniotomy care, and while managing the client after supratentorium craniotomy, which position is maintained by the client? So first of all, what is supratentorial craniotomy? If we talk about the supratentorial craniotomy, first of all, what is supratentorial? Supratentorial means it is an area is the upper area or upper part of the brain that contains cerebrum, lateral ventricle, third ventricle, some choroid plexus, pineal gland, hypothalamus, pituitary gland, and optic nerves. This is the supratentorial area. And what is craniotomy? If we talk about the craniotomy, it is the surgical removal of the portion of the skull. So here the supratentorial craniotomy is the surgery performed for the upper part of the brain. So here you can see the supratentorial area of the brain that consists of pineal gland, choroid plexus, cerebrum, third ventricle, and this lateral ventricle, then hypothalamus, then pituitary gland, and then optic nerve. All these areas of the brain comes under the supratentorial area, and another one area is infratentorial area that consists of cerebrum, tectum, fourth ventricle, spinal cord, and the brain stem. So here you see in the image that this is the supratentorial area that consists of these all structures. So after this surgery, in which position the client will be placed? So for the correct answer, take a look towards the options. If we talk about the options, the first option is prone position. Can we place client in a prone position after this surgery? So prone position is not given after the supratentorial craniotomy because it can increases the intracranial pressure in the client. So prone position is avoided after that surgery. And the second option is supine position. Supine position also increases the intracranial pressure. So this position is contraindicated here. And the option third is semi-fowler position. If we talk about the semi-fowler position after supratentorial craniotomy, the client head is usually elevated 30 degrees to promote the venous outflow through the jugular vein and modulate the intracranial pressure. So this position is best provided here after the supratentorial craniotomy. And the next option is dorsal recumbent position. So it cannot be given because it may also give rise to the increased intracranial pressure. So dorsal recumbent position is also contraindicated here. So the correct answer of this question is semi-fowler position. So here you can see the various positions. This is the prone position. Then the client lies on his abdomen, and this is a supine position. The client lies flat on his back. And here you can see this is a dorsal recumbent position. And this one is the semi-fowler position. In it the head is usually elevated about 30 degrees. And this is the best position provided after the surgery, that is supratentorial craniotomy. So here the right answer of this question is semi-fowler position is provided to the client after the supratentorial craniotomy. Now the next question is, an infant has been found to be human immunodeficiency virus, that is HIV virus positive. When teaching condition specific care, which action should the nurse instruct the mother to take to minimize the child's risk for condition related injury? So in this question, the infant has HIV positive. When teaching about the specific condition care of the infant, the nurse should instruct the mother of infant to take which action that helps to minimize the risk related to the child's related injury. So first of all, what is HIV? What is human immunodeficiency virus? If we talk about the HIV virus, the HIV virus is that virus attacks the immune system, and HIV virus weakens the immune system by damaging the CD4 cells. And if we talk about the various causes of HIV, so HIV is mainly caused by a virus, and it can spread through the sexual contact, and by the infected needles or sharing the needles, and by contact with the infected blood, and also from mother to child during pregnancy, childbirth, or during the breastfeeding. These are the main causes of transmission of HIV virus. And what are the various signs and symptoms of HIV? So here there is fever, chills, rashes, and there may be night sweats and sore throat, fatigue, and swollen lymph node. These all are the signs and symptoms seen in the patient with HIV positive. So, according to the question, what instructions the nurse provides to the mother to minimize the child's risk related to the injury? Let's see the options here. Here the first option is check the anterior fontanelle for bulging and sutures for widening each day. So it is unrelated to the pathology associated with the HIV. So this option is an incorrect option here. And the second option is feed the infant in an upright position with the head and chest tilted slightly back to avoid the aspiration. So according to the option second, feeding the infant in an upright position is not appropriate here to minimize the risk for injury in HIV positive infant. So this option is also incorrect one here. And if we talk about the option number third, provide meticulous skin care to the infant and change the infant's diaper after each voiding or stool. So according to the option third, it is the correct one option here, because meticulous skin care helps to protect the HIV infected infant from secondary infections. So this option is a correct one option here. And if we talk about the option number 4, that is feed the infant with a special nipple and burp the infant frequently to decrease the tendency to swallow air. So use of special nipples are unrelated here with the pathology associated with human immunodeficiency virus. So this option is also incorrect option here, that is not related to minimize the child risk for conditions related to injury. So in this the correct option is option number third, that is provide only meticulous skin care to the infant and change the infant's diaper after each voiding or stool. That will help to protect the HIV infected infant from any of the secondary infections. So here you can see the correct option of this question is option third, provide meticulous skin care. Now the next question is, the nurse is checking post-operative prescriptions and planning care for a 110-pound child after spinal fusion. Morphine sulfate 8 mg subcutaneously every 4 hours, PRN for pain is prescribed. And the pediatrician medication reference states that the safe dose is 0.1 to 0.2 mg per kg per dose every 3 to 4 hours. From this information, the nurse determines what about the prescription. So, in this question, the nurse is checking the post-operative prescriptions, that is after the surgery, and planning care for the child whose weight is 110 pound. The weight of child is 110 pound. So if we convert the 110 pound into kg, so here the 1 kg is equal to 2.2 pounds. Pounds is denoted to be as a lbs, labs. So 1 kg is equal to 2.2 labs. So according to that, this 110 pound divided by 2.2, that it will be equal to 50 kg. So the weight of the child is 110 pound, and in kgs, if we talk about in kg, it is 50 kg. So here the child whose weight is 50 kg, and the nurse is planning care after the spinal fusion. So here the prescribed dose for the child for morphine sulfate is 8 mg subcutaneously every 4 hours. PRN means when needed for pain is prescribed. So according to the pediatric medication reference state that safe dose is 0.1 to 0.2 mg per dose every 3 to 4 hours. So according to this information, what is correct regarding the prescribed dose? Now here you can see 1 kg is equal to 2.2 labs, and 110 pound is equal to 110 divided by 2.2, that is equal to 50 kg. So weight of the child in kg is about 50 kgs. And we talk about the safe dose prescribed by the doctor. So here the prescribed dose by the doctor is 8 mg, and the safe dose is 0 to 1 mg, 0.1 mg per kg to 0.2 mg per kg. This is the safe dose. So the safe dose is so here let's convert the 0.1 mg per kg and 0.2 mg per kg into mgs. So if we convert it, so according to the formula, 0.1 mg per kg means the weight of the child is 50 kg. So here we can divide 0.1 mg by 50. So here here we have 5 mg. The dose is 5 mg, and the next is 0.2 mg per kg. So here 0.2 mg multiplied by weight in kg is 50, then it will be 10 mg. So the safe dose of morphine is between 5 to 10 mg. And here the prescribed dose is 8 mg. The dose prescribed by the doctor is 8 mg. So here the 8 mg is the safe dose, that 8 mg lies between the 5 mg and 10 mg. So what is the correct answer of this question? Let's move towards the options. Here the first option is the dose is too low. No, the dose is not low. It is an appropriate dose prescribed by doctor. So this is an incorrect option here. And the option second is dose is too high. No, this is not a high dose prescribed by a doctor. So this is also an incorrect one option here, because it is an appropriate dose prescribed of morphine. So the next option is the dose is within the safe dosage range. Here this is the correct one answer, that this dose lies within the safe dosage range. And the next option is there is not enough information to determine the safe dose. Here we have the enough information to determine the safe dose of the morphine. So this is also an incorrect one option here. So according to the question, the right option is option third, that is the dose is within the safe doses range, because the doctor prescribed the 8 mg and the safe dose is doctor prescribed 8 mg and the safe dose is the doctor prescribed the 8 mg and the safe dose is 5 to 10 mg. So the dose prescribed by the doctor lies within the safe doses range. Now the next question is, what action should the nurse take to assess the pharyngeal reflex on a child? So according to the question, how the nurse should check the pharyngeal reflex in a child. If we talk about the pharyngeal reflex is also called gag reflex. As you all know about the gag reflex, pharyngeal reflex is also known as gag reflex. And what is this pharyngeal or gag reflex? If we talk about the gag reflex, it is a muscular contraction of the back of the throat evoked by touching the roof of the mouth, the back of the tongue, and around the tonsils and the back of the throat. Here you can see in the picture, this is a picture of a gag reflex, and this gag reflex is checked by evoked the back of the throat by touching the roof of the mouth. Here it can be touched roof of the mouth and back of the tongue and around the tonsils and the back of the throat. By this way we can assess the gag reflex. So by this way the nurse should check or assess the gag reflex is present or not. So here, according to the question, which action is taken by the nurse to assess the pharyngeal reflex, that is gag reflex? So to find out the correct one answer, let's move towards the options. Here the option first is ask the client to swallow. If we talk about the option first, that ask the client to swallow, asking the client to swallow assesses the swallowing reflex, not pharyngeal reflex. So this one is incorrect option here because it indicates the swallowing reflex. And the second option is pull down on the lower eyelid. To assess the palpebral conjunctiva, the nurse would pull down the lower eyelid. So in option second, if the nurse would assess the palpebral conjunctiva, then she will ask the client to pull down the eyelid. So this one is also an incorrect option here. It cannot assess the pharyngeal reflex. It may assess the palpebral conjunctiva. And the option third is shine a light toward the bridge of the nose. So if we talk about the option number third, the corneal light reflex. This indicates the corneal light reflex. When we shine a light on the bridge of the nose, then it indicates the corneal light reflex. This reflex is tested by shining a pen light towards the bridge of the nose and at a distance of 12 to 15 inches. So this will indicate the corneal light reflex when we shine a light on the bridge of the nose. So this is also an incorrect option here. And the next option is stimulate the back of the throat within a tongue depressor. So this is the correct one option here. That pharyngeal or gag reflex is tested by touching the back of the throat with an object like tongue depressor, as we already discussed. When we stimulate the back of the throat or the back of the tongue or the area around the tonsils and the back of the and the roof of the mouth. So by touching these all areas with any object or tongue depressor, there is it may cause stimulation. So this will indicate that there is a gag reflex present or not. So here the option 4 is the correct one answer of this question, that will indicate the gag reflex or pharyngeal reflex. So here the right answer is option 4. Stimulate the back of the throat with a tongue depressor. Now the next question is, the pediatric nurse specialist teaches nursing students about mumps. Which clinical manifestation will the specialist identify as the most common complication of this disease? So in this question, there is a pediatric nurse specialist who teaches the nursing students about the mumps. So what is the most common complication of this disease according to the clinical manifestation? Identify the nurse specialist. So first of all, if we talk about the mumps, so what is mumps? Mumps is a viral infection that mainly affects the salivary glands, and in it there is the inflammation of the parotid glands, that is called parotitis. Parotitis is the inflammation of the parotid glands. So how the mumps spread? If we talk about the spreading of the mumps, it can be spread by airborne droplets like during coughing or sneezing, and the second one is it can be spread by touching the contaminated surface, and it also transmitted by the saliva like during kissing or sharing drinks. So these are the various modes of transmission or spreading of infection of mumps. Now what are the main signs and symptoms that are seen in the mumps? So here the first one is swallowing or painful salivary glands, and the second one is fever, and there may be headache, and fatigue may be seen in the patient with mumps, and also there is a loss of appetite seen in the patients. So these all are the main signs and symptoms of the mumps. In this picture you can see the image of the mumps, that is there is a swallowing parotid glands. This you can see the swallowing in the parotid glands or salivary glands. So this is mumps. Now in the question here ask about the most common clinical manifestation of the most common complication of mumps. So if we talk about the most common complication of mumps, the most common complication of mumps is aseptic meningitis. That is aseptic meningitis, and the meningitis is inflammation of the meninges of the brain and spinal cord. So it is the most common complication seen in the patient with mumps, and the virus is being identified in the cerebrospinal fluid of the client. So common signs of aseptic meningitis includes knuckle rigidity and lethargy and vomiting. Knuckle rigidity means there is a stiffness in the neck. So here the sign of the most common complication is knuckle rigidity, that it includes in the option. So here the most common sign of most common complication seen in the mumps is knuckle rigidity. So the right answer of this question is option second, that is knuckle rigidity. It may be seen as a clinical manifestation of most common complication. Most common complication is meningitis. Mumps most common complication is meningitis, and the most common sign of meningitis is knuckle rigidity. So here the right answer will go to knuckle rigidity. And if we talk about the option first, that is pain. So if we talk about the pain, in mumps there is a muscular or parotid pain may be seen, but pain does not indicate a sign of complication. Pain is not a complication. So it is an incorrect option here. And if we talk about the option number third, that is impaired hearing, and in it impaired hearing. Mumps is on the leading cause of unilateral nerve deafness, but it is not occur more frequently, so it is not a most common sign of complication. So impaired hearing is also a incorrect option here. And if we talk about the option 4, that is a red swollen testicle. So in this option, a red swollen testicle maybe indicates orchitis, and although this complication appears to cause most concern among the parents, but it is not the most common complication caused by mumps. So in the mumps, mainly swollen and tender salivary glands seen under the ears on one or both sides of the head, as we seen in the picture, that is parotitis, and this is the most common sign of most common complication. So here, according to the question, the right answer of this question is knuckle rigidity. Here it can be seen most common manifestation of most common complication of mumps. Now the next question is, an adolescent is hospitalized with the diagnosis of Rocky Mountain spotted fever, that is RMSF. The nurse anticipates that which medication will be prescribed. So here an adolescent, the adolescent means the person whose age group is between 12 to 18 years, that is considered to be as a adolescent client, and the adolescent is admitted in the hospital with the diagnosis of Rocky Mountain spotted fever. So which medication is provided to the patient? So first of all, if we talk about what is Rocky Mountain spotted fever. So the Rocky Mountain spotted fever is an infectious disease with rashes, and it is mainly transmitted by a bite of a tick. It is a fatal disease, means life-threatening condition, and it is usually caused by a bite of a tick, and this tick is infected with Rickettsia group bacteria. So this is the Rocky Mountain spotted fever. Here you can see the various signs and symptoms of Rocky Mountain spotted fever. So in it, fever may be seen, headache can occur in the client, and there may be a rashes seen in the client with Rocky Mountain spotted fever disease. Here you can see the various signs and symptoms of this disease. First one is there may be a high grade fever, and there is a headache and stomach ache, and nausea and vomiting can be seen in a client with the Rocky Mountain spotted fever disease, and there may be a lack of appetite, and having a muscle pain or soreness, and having a rash that usually starts on the wrist and ankles, and the symptom is like the client is sensitive to the light, that is photophobia is seen in the client with this disease, that is Rocky Mountain spotted fever disease. And as we discussed, this disease is mainly caused by a bite of a tick. So here you can see a type of a tick. This is a type of a tick that is responsible for transmitted of Rocky Mountain spotted fever disease, and this tick is mainly infected with Rickettsia bacteria. So according to the question, which medication is prescribed to the patient with the Rocky Mountain spotted fever? So for the correct answer of this question, let's move towards the options here. So here the first option is the medication ganacyclovir. If we talk about the ganacyclovir, this medication is mainly used to treat cytomegalovirus. So this is not used for the treatment of this Rocky Mountain spotted fever disease. So it is an incorrect one option here. And if we talk about the second option, that is amantadine. So if we talk about the amantadine, it is used to treat the Parkinson disease. So this is also an incorrect one here. It is also not used in the treatment of Rocky Mountain disease. And the third option is doxycycline. Here doxycycline is a correct one answer of this question. And the alternative medication of Rocky Mountain spotted fever is chloramphenicol. So, doxycycline is prescribed for the client with the Rocky Mountain spotted fever disease. And if we talk about the next option, that is amphotericin B. So, amphotericin B is an antifungal medication and mainly used in fungal infections. So, here the right answer of this question is doxycycline. Amoxicillin is also an incorrect one option here. Here the only right answer is doxycycline. It is used as a treatment measure of the patient with Rocky Mountain spotted fever disease. So this is all about the today's questions. I hope you all like the questions. If you want to watch previous episodes of question, you can go to the channel's playlist and watch the previous episodes of questions. And thank you for watching the today's video. Stay tuned for the more such videos and next episodes of videos. Thank you.